Endometriosis is a chronic condition that affects 6.5 million women in the United States. That is 1 out of every 10 women. Endometriosis is defined as a condition when the tissue that makes up the uterine lining is present on other organs inside the female body. Endometriosis is excruciating and can hinder women from having children. When women talk about that time of the month, people tend to push it off to the side and think that they are just exaggerating the pain. But this informative speech is to inform the audience that some women do have a condition that keeps them stuck in bed, clutching a heating pad, hoping, praying, wishing that they would just get just a moment or a break from the pain. In this speech, I will discuss 3 main points. And the first is, what exactly is endometriosis? What are the symptoms and who does it affect? My second point is, what causes endometriosis? How can you prevent it? How is it treated? My third point is to inform people the struggles that women face. I believe more people need to know about endometriosis because you never know. It could be your mother, it could be your sister, it could be your aunt. There's so many women in this world that have endometriosis, and it's a serious condition, and it really, really does hurt. Endometriosis sucks. I know. I'm 1 in 10. Right here is a diagram of a uterus, and endometriosis occurs when endometrium, tissue that acts like the lining of your uterus, starts growing outside of the uterus where it doesn't belong. The endometrial-like tissue that grows outside of your uterus is called lesions or implants, and that's what these would be lesions. When estrogen levels rise, these lesions or patches can grow. Later in menstrual cycle, they break down and shed, and they cause pain throughout the month. These lesions are fueled by a sex hormone called estrogen. And to just give you a little bit about this, this is the uterus, and you have the ovaries, and the endometrium, and the cervix. Now that we know what endometriosis is, let's talk about the symptoms. Endometriosis has a lot of pain. Pain is the most common symptom. Women who have endometriosis experience very painful menstrual cramps. There's normal women cramps, and then there's endometriosis menstrual cramps. And it hurts really bad. It feels like somebody is taking a knife and stabbing your uterus and your ovaries and just that whole genital area. And some women have chronic long-term pain in the lower back and pelvis. Sometimes it's painful to have sex. Sometimes women have intestinal pain or painful bowel movements, or even just pain when urinating. Honestly, it's just really, really painful. Why does endometriosis cause so much pain? Endometriosis happens, when the lining on the uterus or the womb grows outside of the uterus, and that doesn't belong there. So these growths can swell, and it causes them to bleed in the same way that the lining of your uterus does every month. But instead of like normal women who have a period and the blood goes out, you have it stuck in your body. And so the growths may continue to expand and cause problems, such as blocking the fallopian tubes, or grow into your ovaries, and it traps blood in the ovaries and it forms cysts. It can cause inflammation, which is swelling. It can form scar tissue or adhesions, which is a type of tissue that binds the organs together. The scar tissue may cause pelvic pain, and it makes it extremely hard to get pregnant. And it also, it causes problems in your intestines and bladder. So this right here is retrograde menstruation. It's where the menstrual blood containing endometrial cells flow back into the fallopian tube and then go inside the pelvic cavity instead of outside the body, as you can see right here where it just all kind of like came out. This could be one of the biggest explanations for why women get endometriosis. Another explanation is the transformation of peritoneal cells. It is also known as the induction theory, where the hormones or immune factors promote transformation of these cells, the cells that line the inner lining, the inner side of your abdomen, into your endometrial cells. Another explanation is the surgical scar implantations. After surgery, like a hysterectomy or a C-section, endometrial cells may attach to the surgical incision. The third point is the struggles women face. Endometriosis affects women not just physically, but throughout their relationships and social lives and their plans. It affects women at their school and at work. Having endometriosis comes with excruciating, dilapidating pain. So if she can't get out of bed, how can she go to school or to work? Endometriosis makes women miss things because the pain, or maybe not being able to stop throwing up, or they just honestly do not have the energy to get up and do something because their body is so worn out from the pain. And a few studies have been done, and the studies found that the endometriosis impairs health-related quality of life, specifically in areas related to physical, psychological, and social functions. It takes many years to be diagnosed with endometriosis. Some doctors don't take the pain seriously. Some women begin experiencing endometriosis when they are young, like 12 to 13, or when they first begin their menstrual cycle. But they don't get diagnosed until they're an adult. That could be their 20s or 30s or even 40s. Dr. Tamar Second said, "The lack of knowledge among doctors, a social stigma around periods, and the fact that there is no single diagnostic test all contributes to the often long road to an endometriosis diagnosis." He also says endometriosis is a disease that is associated with menstruation. There are taboos and stigmas around it, and it is very personal. Dr. Tamir Second said, "The problem is also the disease, because it's not your typical disease. There is no test and there's no biomarkers. Doctors would easily misdiagnose this." What is endometriosis? What causes it? And the struggles that women face are the three main things I hope you learn. Endometriosis is a serious thing, and we need to talk about it. We need to make it not so taboo to talk about. Talk to your friends, your family, your doctors. Make endometriosis and periods easier to talk about. Make it known. Maybe if more people know about it, then maybe they can finally find a cure, or even just something to help prevent it or help with the symptoms.